Hello and welcome to the latest episode of Top Tips for Asthma and Lung Health. Today, GP Dr. Andy will take you through such questions as the best ways to manage your lung condition during lockdown, what to expect if you're about to receive the COVID-19 vaccine, and how the vaccine can affect people on certain types of medication. If you find this video helpful, please do consider making a donation or leaving a comment, giving us a like, or subscribing to our channel today. Today's Q&A is brought to you by Asthma UK and the British Lung Foundation. Our campaign manager, Joe Aldrich, will be talking to Dr. Andy, who is the in-house GP for both the British Lung Foundation and Asthma UK. And whether you have asthma or whether you have another lung condition, Dr. Andy will be taking you through what to expect when you go to get your COVID-19 vaccine. And he'll be giving you an update as well on the vaccine for people who are taking immunosuppressants or biologics. If you need any more information about any of the topics discussed today, you'll find lots more useful links in the description below. And remember to please subscribe to our channel so you don't miss out on any of our updates or advice. And stay tuned to the end as well, because we'll also be talking about how to deal with stress and anxiety during these unusual times.
Hello, Andy. Thank you so much for joining us once again for another Q&A.
Hiya, Joe. How are you?
Very well, thank you. Very well. So, Andy, as before, I'm going to go through a list of frequently asked questions with you, many of which you'll be unsurprised to hear are about the COVID-19 vaccine.
Absolutely. So many people have got questions about this at the moment, so not surprised that you're asking me them today.
Excellent. Well, the first one doesn't relate to the COVID-19 vaccine. It's more about general lung health for people and how they can look after themselves. So we know there's a lot going on at the moment and that people might not be managing their conditions as well as they usually do. So what can people with a lung condition be doing to make sure that they're looking after themselves?
Okay, so nice, easy starter. Thanks, Joe. So I would say that there's three areas I want people to start looking at. One is their general physical health, their general mental health, and then more specifically, their respiratory health. So in terms of their general physical health, people should really be making sure they're keeping a good routine, that they're eating and drinking well, they're not having too much alcohol, so keeping that to a minimum. They should be trying to get exercise on a regular basis. I know we're allowed to go out and do exercise, but keeping active can keep us physically and mentally well. It's very important for us to do that. And this is also a great time to stop smoking as well. So people can sort of get help to reduce what they're smoking, to stop smoking, and make that a habit that they can give up properly. And one thing I think we all neglect a little bit is making sure we get enough rest and enough sleep. So I think everybody should be looking at trying to build those things in. Those things will also have a knock-on effect on mental health. So at the moment, we're seeing so many people with low mood, anxiety, stress, and whether you've got mild or more severe mental health issues at the moment, make sure you visit the Asthma UK or the BLF websites for information about what you can do to get back in control of that. Don't forget also your GP is there to help you, even if you have got mild symptoms, and we'd rather talk to you and help you get better before things get worse, rather than later when it's more difficult and more of a problem to you. And also, just a heads up, I've written a blog this week about mental health for people with respiratory issues. So keep your eye open for that, and we'll hopefully get that to you shortly as well. In terms of your respiratory health, I think there's lots of things that we should all be doing. If you're on medicines, take them as they're being prescribed, so take them regularly. If you take inhalers, visit our Inhaler Videos website and make sure you're doing the inhaler technique as best as you can so the drugs are getting where they're needed. If you have a reliever inhaler, carry it with you when you're out and about doing exercise and so on. And if you are offered an appointment for review for your respiratory condition, make sure you attend it. They're not all happening at the moment, and many are happening over the telephone or over video call, but they're still useful. There's still an opportunity to check that you're okay and get advice and support from your clinical team. Most people with respiratory problems also have a self-management plan or an action plan. If you have one, make sure you're keeping a note of where that is, following the instructions on it, and doing the best that you can to stay well. People with asthma and COPD can look on our websites to again find themselves an action plan, and they can always speak to their healthcare professional next time they're in contact with them. And finally, I think if you do get any changes in your symptoms, make sure you do report it or take action early, because this might be a sign that things are getting worse or there's something else that we need to be doing to help you. So don't ignore that, and certainly don't delay getting help if things are changing.
Excellent. That's really helpful, Andy. And we'll be including links in the description at the underneath the video here. Also, they'll be popping up on screen as well, so people can click on those to go through to useful web pages as well. And I know you mentioned about people doing video appointments and things like that. So we'll make sure that we share the video that I believe you recorded on how people can make the most of a video appointment with their GP or
Yeah, I mean, it's not. I mean, for some people, it's more natural. It's things that we're now used to doing, chatting on the phone and chatting over computers. But for some people, it's a really new skill, and there's some good hints and tips on there about how people can prepare for it and get the best out of it as well.
Excellent. I might watch it myself. So the next question is about the COVID-19 vaccine. So with the vaccine rollout gathering pace, we know people might be wondering what happens when they get theirs. So could you guide us through what people can expect on the day, please?
Well, first thing to say is that people will be invited for their vaccine. So they'll either be contacted by their GP or they get a letter from the NHS. I will just I don't want to scaremonger, but just to warn people, there are some scams out there at the moment. So whoever you're contacted by, nobody should be asking you for any money or bank details. So if there's anything like that, then delete it and ignore it. But you should know if it's from your GP or from the NHS. When you do get that invite, you might get the option of having your vaccine at the NHS vaccination centre near you or with your local group of GPs. It doesn't matter who you go with, and some people choose to get it done as soon as possible, and some people prefer to wait for their GP's practices to do theirs. But it's completely up to you. But as I say, at the moment, people are generally going for whatever comes soonest. You won't get a choice of which vaccine you get. They're all considered good enough. The only thing we would say is that people who've got severe allergies, such as anaphylaxis, so people who need an adrenaline pen, shouldn't be having the Pfizer vaccine. But that's the only real stipulation at the moment. So on the day itself, if you've got symptoms that might be COVID, please do not come for your vaccine. You'll be told book a test for COVID, and you'll be given another opportunity to book for your vaccine at a later date once you know the result and once your isolation period is done. If you are self-isolating, you must wait until after your self-isolation period before coming for your vaccine. Don't be tempted to come early. We don't want COVID spreading among the people who are waiting for their jabs, and you will still get your turn. So don't be afraid to just wait till everything's over and done with. If you have had COVID, we are advising people to wait for 4 weeks afterwards, and that's almost so that your immune system can recover and you get the most benefit from the vaccine when you do get it. Some people have been asking whether they can have the vaccine if they've got long COVID symptoms. So this are people who have got symptoms many weeks after they've had the COVID infection. And at the moment, we don't think there's any reason why people should be delaying it. It's more important to get cover with a vaccine than waiting. When you attend on the day, you will be expected to wear a mask if you can. Follow the instructions that you're given on the day when you turn up, and there's usually people signposting you to where you've got to go and where to wait. And things like hand sanitizer and things should be available as well. Somebody will be asking you questions just to make sure that the vaccine is okay for you on that day. So that they'll ask you whether you're part of any COVID trials, because some people here will have had a COVID vaccine already but not know it. Some people we will ask about whether they've had any serious allergic reactions. Again, this is so that they're not given the vaccine when it might be unsafe for them. We ask everybody about whether they're on any blood thinners. That's drugs like warfarin, edoxaban, rivaroxaban, apixaban. And the main reason for this is that some people might bleed after the injection, or they might have a bruise at the site of the injection, which you sort of expect, but it's just something we do warn people about. And we also ask people whether they're pregnant or breastfeeding. And this is not so much that we don't think it's safe, it's more that the vaccines are untested in this group, so that we can have a safe chat with them about whether they think it's in their interest to have it or not. And generally the advice is it is, but some people, we just need to go through it with them to make sure they're happy with that. So the jab itself is given in the upper arm like most vaccines. And I tell my patients that there are possible side effects you might get because of the vaccine. So obviously you might get a sore arm afterwards. Some people describe tiredness, some people get a bit nausea, some people feel a bit achy. Personally, I had a headache for about 12 hours afterwards and it went away without any medicine, and I was able to continue working. So it was quite mild overall. For people who had the Pfizer vaccination, we're advising that they wait for 15 minutes afterwards, and this is just to make sure they're okay. And out of the 10,000 jabs that we've given at our surgery, there's been nobody who's had any problems soon after the injection. Everybody should be given a card which tells them the vaccination that they've had and also when the next appointment is due. And usually that's about 11 or 12 weeks after the first one. We're recording on our computer system when we do it, but we're also recording on a national computer database so that the whole NHS knows whether you've had it or not. So if you get the injection at a vaccination centre, they'll be able to tell your GP surgery whether they've had it or not. Does that make sense, Joe?
Yeah, I think that's really helpful, Andy. I know you mentioned about people obviously having COVID or not coming to have the vaccine and obviously waiting for 4 weeks afterwards. What about if people are just kind of generally feeling unwell or they've been in contact with somebody who's been positive or who's tested positive for COVID?
So if somebody's been in contact with somebody who's tested positive, they should be advised to self-isolate anyway. So following the government rules and not going for your vaccine during that period of isolation. Because it's possible you might have the vaccine and then spread it to the doctors and nurses giving the jabs, but also the other people who are waiting for the jabs on the day. So it's better to be safe than sorry and waiting for another opportunity, which shouldn't be too long away.
Excellent. Thank you, Andy. That's really helpful. And for anybody watching, just to say, we'll be including links in the description below. And if you find this video useful, then please comment, like, or subscribe to the British Lung Foundation channel. And also, just to say, all the advice that we're providing is correct at the time of filming, but obviously with a situation like COVID-19 that rapidly changes, sometimes the information we give can go out of date. Andy, the next question I've got for you, again, it relates to the COVID-19 vaccine. It's about specific medications. So can people who are taking immunosuppressant medicines have the COVID-19 vaccine?
Yeah, this is something we're getting asked a lot, and the answer is yes, absolutely. It is essential, actually. Because somebody on immunosuppressants has got a poor immune system, the effect of COVID could be more dangerous for them than for other people. We know that the vaccines are safe. We know they're not live, so they can't give you COVID. How effective they are, we still don't know. But what we do know is that, so when I say effective, I mean for people who've got a low immune system. It's whether their immune system reacts and creates the antibodies that they need. We think they should do, but we don't know for definite yet. But as the vaccine is safe, and as the effects of COVID is so dangerous, we're saying that everybody should be getting the vaccine as soon as possible. Because even if they don't get the full effect, they'll be getting some protection, so that they'll be getting a less severe illness if they did get it.
That's great. Thank you, Andy. So the next question, again, relates to people on certain medications. So we know a lot of our supporters will be taking medicines for their lung condition, and some might be wondering whether their treatment should continue as normal when they've had their COVID vaccine. For example, can people who take biologics, which some people might know as MABs, for their asthma, get the vaccine?
Yes, so obviously lots of people take lots of different combinations of medicines. So if I start with the biologics first, if you're on a biologic for asthma, you should be getting an invite and you should have the vaccination. So very similar to people with immunosuppressants, we've got no evidence to say they're unsafe. We know it's not a live vaccine, so it shouldn't give you COVID. And it's far more important that you get the vaccine and protect yourself than you leave yourself at risk of getting COVID. What the British Thoracic Society, that's the group of doctors advising respiratory specialists around the country, say is that they advise having the vaccine on a different day to having your biologic, and ideally 7 days apart, but you shouldn't be delaying getting the vaccine because it falls on the same in the same week as your biologic. So do speak to your specialist if you're concerned, and as long as it's on a separate day, you should be absolutely fine. And I say, so far, the people that we've been giving it to, I've not noticed any issues with. Now, there are lots of other medicines as well, and I've touched a little bit on blood thinners, so drugs like warfarin, apixaban, rivaroxaban. And the only reason we ask about that when people come in for the vaccine is because they obviously might bleed where the needle goes in, and some people are more likely to bruise up afterwards. With warfarin, people are very used to getting a regular blood test. So it would be really useful for their GP or nurse or whoever's given the vaccine just to know that their recent iron air blood test was within normal limits for them. So not sky high or off the chart at all. So if you do know what your last INR was, make a note of it and bring it to you to the vaccine appointment. There are no regular respiratory medicines that we advise people stopping or delaying. So if you're on inhalers or tablets, keep taking them as normal. The crucial thing is that you get the vaccine to protect you from the effects of COVID.
Great, I think that's really helpful, Andy. Thank you. So the final question that I've got for you is more about people's well-being. So we know a lot of people might be quite stressed and anxious at the moment. Can stress be a trigger for some people's lung conditions? And if so, what can they do about it?
Well, mental health issues and stress go hand in hand with people with long-term conditions like respiratory problems. And it goes both ways. So people who have got a long-term condition, whether that's asthma, COPD, bronchiectasis, fibrosis, lung cancer, they can struggle because of the impact of the disease or their medicines on their life, how it affects the people who are around them as well. So it can make people low. And actually having a respiratory issue, especially at the moment, makes people worry. They worry about the effects of viruses and catching it and what that might do if they end up in hospital. So absolutely, having a respiratory condition is meaning people are more worried and are developing mental health issues. On the other side of it, though, having anxiety, stress, or low mood can also affect people's breathing. So people who are more stressed are more likely to have abnormal breathing patterns. They're more likely to be tense. People with mental health issues are less likely to remember to take their medicines regularly or correctly. And we do know that people with stress, anxiety, depression are more likely to get chest symptoms, especially in conditions like asthma. So what we tend to advise, what I advise people to do is to maybe keep a bit of a diary to see if there's a link between how they're feeling and what their physical symptoms are, to find time every day to make sure that we relax and switch off. So that might be listening to music, watching your favorite TV program, doing yoga, mindfulness. And I know we've done some brilliant webinars on that as well. But first thing I'll do is actually visit the Asthma UK and BLF web pages, and maybe even both of them, because they've both got different hints and tips for people with respiratory conditions, and about how to feel in control of your mental health, but also some simple things that you can do to get on top of it. And don't forget also that your GP is there to help you as well. Make sure you make contact with them early to get help. Sometimes we do prescribe medicines, but usually it's about making sure that you get the support you need, even talking therapies, or just signposting to websites and things that can make a massive difference. So talk to people, talk to friends and family, speak to your GP, have a look at those websites. There is so much out there to help you, so definitely don't suffer, and don't suffer alone.
Andy, that's really helpful. Thank you so much. For everybody watching, I'd just like to say all the links that Andy mentions will be included in the description below. And if you find this video useful, please add your comments, give us a like, or subscribe to the British Lung Foundation's channel. Also, the webinars that Andy's mentioned, there should be a link on screen for those. So thank you very much, Andy. Thanks again for taking the time to answer my questions.
That's right. They're great questions again, Joe, and I really appreciate people sending them in. because if you're asking it, then there's probably another 10 people who are thinking about that question. So definitely get them in and let Joe know what you want to ask me.
Exactly. Thank you so much. And just to say one last time that that all the advice that we are providing today is correct at the time of filming, but we are aware, obviously, that the ever-changing situation that is the COVID-19 pandemic can mean that sometimes the advice goes out of date.
Yeah, we are updating our website regularly, though, so people can keep an eye on that as well.
Exactly. Thank you, Andy.
Thank you.
Speak soon.
Bye-bye.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you liked the video and you found it useful, please do give us a like, leave us a comment and subscribe to our channel. As mentioned, you can find loads of really useful links in the description below. And if you feel able, please do consider making a small donation to support the work of Asthma UK and the British Lung Foundation.